Hi everyone, I'm Hazwani Ahmad Yusuf, alias Hanafi, Head Program for Master of Science, Clinical Exercise Science and Academic Program offered by Advanced Medical and Dental Institute, University Science Malaysia. MSc Clinical Exercise Science Program is under Lifestyle Science Cluster, a cluster that was established in order to promote healthy lifestyle. We are a team of medical specialists and also scientists who are from different scopes or area. We have psychologists, we have secretaries, we have family medicine specialists, we have pathologists, immunologists, public health specialists, and also exercise science experts in our group. From this picture, there will be some situation where you go and find the doctor to ask about your medical problem. So instead of getting the medication, you might also ask the doctor how to get fit and healthy in your life. So the doctor will give some short advice such as go spend at least 1 hour per day on the treatment. Some people actually misinterpreting the advice by the doctor by not actively using the treatment. This is because they have not clear about what kind of exercise they actually need to do. Whether do need only to perform brisk walking or cycling or jogging or swimming, they are not sure what kind of exercise that actually they can do to manage their condition. That's why there is a need of a health profession that can give them guideline or help them in preventing and managing their condition. Then, to fill the gap in the current health prevention, that's why a new health profession had been introduced, known as clinical exercise physiologist, that had been introduced in the late of 1960. This is a very unique and important profession where this profession will design, implement and supervise exercise programming for the clinical population. The clinical exercise physiologist will cover the management for chronic disease that will reduce the risk for early development or recurrence of chronic diseases, and also will creating lifestyle habits that will promote the enhancement of health, and also facilitating the elimination of barriers to habitual lifestyle changes of the patient by improving the daily living activities, and also to increase the likelihood of long-term physical, social and economic independence of the patient. The clinical exercise physiologist is different from physiotherapist, where the physiotherapist is normally treats the patient with acute injuries or who needs an acute treatment. But those patients who have been diagnosed with non-communicable disease such as cancer, asthma, hypertension, diabetes, mental illness, or sometimes the cardiac related, or the patient who are present with reoccurrence of acute pain that had been lasted for 3 months, or the patient who had been not improved after 3 months treating with the traditional treatment will be referred to exercise physiologist for long-term management. Due to the need of clinical exercise physiologists, the master program of clinical exercise science had been introduced in MD-USM. The objective of this program is we want to produce a healthcare practitioner in Malaysia or in surrounding region in prevention and managing the non-communicable disease. The student will focus more on the use of exercise testing and training in person with NCD problem. All the students with background in areas related to health, science, physiotherapy, like nutrition, nursing, biomedical science, exercise and sports science are welcome to join us. Why CS in AMDI? Because this program is only offered in AMDI USM. Not only in Malaysia, we are the only university that offer this kind of program surrounding of Southeast Asia. The student will be trained by the in-house expert in exercise and specialist, and this program is only 1 year program, and the co-curriculum structure of this program had been designed accordingly to what being suggested by Exercise Sport Science Australia and American College of Sport Medicine. This program consists of 3 semesters, where during the first semester, the student will be introduced to pathophysiology of non-communicable disease, nutrition in health and disease, applied psychology, the fundamental knowledge about exercise physiology, the principle of exercise testing and exercise prescription, and as we are research university, our student will also introduce to professional and research skill. Meanwhile, in second semester, the student will learn about perspective and practice in health promotion, will specifically know how to assess physiology among the clinical population, exercise programming for clinical population, and go to the health psychology. We learn about health psychology and also a part of injuries and rehabilitation. After 2 semesters of theory, the student then will go for 10 weeks of clinical exercise practicum during the long semester break. The student evaluation is based on 60% score from the final exam and also 40% score from the coursework mark. Coursework mark would be basically on the presentation assignment given by the lecturers, the essay, and etc. To support this academic program, there are diverse of facilities that we have in AMDI and also in USM, where we have a well-occupied facilities to run a stress test. There is an exercise assignment for cardiac patients before they can enter an exercise program. We have also a well-occupied fitness lab with a variety of equipment for patient conditioning. Not only that, we are working together with rehab unit where our students will be exposed to the real setting in rehab unit, and also the student will be exposed on exercise assessment using the climatic chamber to see the effect of environment or temperature on body regulation. The student also will use swimming pool in main campus for their aquatic exercise session to implement or to learn how to use swimming exercise for preventing NCD problem, especially for aging population. Meanwhile, for 10 weeks of clinical exercise practicum, our student will be placed in the real clinical setting where they will go to certain health sectors such as Pantai Integrated Rehab or Gleneagles Hospital or Pantai Hospital to get exposure on real working setting. Some of them will also be placed in several health sectors such as Physio or Rehab Center, KPJ Tawakal Health in KL, and also Perkaso Rehab in Melaka. For prospect job of our graduate student, as our curriculum is already designed according to what had been suggested by SCSM, our student is already passed the prerequisite to sit and pass the certification of clinical exercise physiologist by SCSM. Not only as SCSM exercise physiologist, the student can also choose to be an health educator or health coach, or also can pursue for academic program as PhD student. We already have 3 batches of this program. The current batch have another 5 weeks to complete their program. Our alumni is currently working in different fields. For example, some of them working as clinical exercise physiologists, as consultant related to clinical exercise field, and also nutritionist nutritionist and fitness coach in private sector, as well as a gym expert and also an educator. If you want to know more about us, you can find us on our Facebook page. We are regularly updating our current activities regarding the program. And if you want to talk directly to us, you can come to Amdi or just email me or Associate Prof. Dr. Ahmad Munir, or can just call me through this list of phone number. Anyway, I think this is the last end of this introduction of our program. I welcome everyone to join our program, and let's start your future career with our program here. And last word from me, get fit for better life. Thank you.